Hi, Amanda. Thank you very much for inviting us. What we want to do is walk you through the plan process, and we've got lots of slides, and then we're happy to take questions afterwards. We just want to give you a general overview of how we approached it and where we are right now. And we are very, very new to this. We just finalized our plan and presented it in November. So this is something that we are just completing and moving from planning into implementation. So it's still a little new to us.
Great. Can everybody hear us okay?
You guys should be good.
Okay, great. Just one tick. Thanks, Amanda.
So a little bit about Montgomery County. We are very typical Ohio County, similar to places like Summit. Our population has been holding steady. Dayton, Ohio is our main city, and it's a population of about 150,000. We have leading causes of death, things like cancer, heart disease, stroke. Our health numbers are among the worst in the state. One of the things that's just stunning is that our life expectancy has actually decreased by 2 years between 2013 and 2017. The national average is 78.6 years. For Montgomery County, it's 74 years. So we're 4.5 years below the national average. So when I turn 70, I'm moving out of here, by the way. So this is, our health numbers are not good. And that was an important consideration as we started looking at what we needed to address. The other thing that's significant for us is that Dayton is one of the most segregated, racially segregated cities in the nation. And the health numbers and some of the other numbers show significant racial disparity. Our white poverty rate is 13%, and the poverty rate for Black Daytonians is 33%, so 2.5 times. Some of our organizations, for example, those working with infant mortality, our Learn to Earn education group, are really addressing some of the racial disparities. And as we began thinking about planning, we felt like that needed to be something that we kept in mind too.
So just a couple numbers of what food equity looks like in Montgomery County. 17% of our residents are food insecure. What is really fascinating that we like to talk about with this statistic is from our food bank. 40% of those visiting our food pantries don't visit more than 3 times in a year. So almost half of the people visiting food pantries, you could assume probably are working poor. It was just 1 month when car broke down or something happened with an unexpected expense, and food was the first thing that got cut from the budget. So it's really important that we feel like there's something to think about of who our community is and what they experience around food insecurity. 30% of our children eat less than 1 serving of fruits and 1 serving of vegetables per day. And it's pretty similar statistics for adults. 41% of adults eat less than 1 fruit per day and 21% less than 1 vegetable per day. And 15% of our landfill is food. And of course, this is important to us because what could we be doing to divert items from going in the food waste? Could we be doing more donating to pantries, starting backyard composting, or how are we moving food from one location to another? And we have over 70,000 residents that are on SNAP or food stamps. This is what the food deserts look like in Montgomery County. You'll notice it's a lot of West Dayton, but also the city of Trotwood is pretty much all yellow. A little bit of North Dayton as well, Northridge area, and then to the south as well, looking at Moraine and West Carrollton. But they all really surround the urban core of Dayton. And food in the news. I don't think this is probably very different from a lot of the communities that you all serve, but we have grocery stores. I would say a grocery store closes every 60 days right now. This slide, when we use it, we have to continue to update it, but I mean, we had a local grocer in Trotwood close, Aldi has closed in the urban core, and Kroger continues to close stores in our food desert, close to our food desert neighborhoods pretty regularly. So we knew it got to an issue where we really needed to start thinking about what we could do right now to help people that they're losing their places to shop for healthy food. And then we also had the tornado, in which we lost one of our grocers in Old North Dayton because of the tornado, and it's still not rebuilt at this point, and still up in the air of what that's going to look like.
So we began to think, what do we need to do about this? And we were very much inspired by Brian and Jaleesa from Franklin County. They presented at our food summit in November of 2017 and showed us the Franklin County food plan. And it was actually 2 years ago this month where we began to talk about what else do we need to do. There are tremendous activities going on around food and hunger in our community. We are building a co-op grocery store called the Gym City Market in one of our food deserts, and that should open in a year. We've raised almost $4 million, very community-driven. We have our food bank was voted the #2 food bank in the nation, and I think it should be #1. They really took over after the tornado damage. We have a place that serves food every day, and they were able to get money to support a family room built on. Our hospitals are getting more involved. We are close to having a mobile grocery store. There's a lot going on, but there's no unity. There's no strategic vision. The projects are happening aside from each other, not with each other. In our community, we've had a few examples we wanted to keep in mind. We have a drug overdose group. We got hit very hard with the opioid deaths, and we pulled a group together through public health in the county. And it made a huge difference by bringing folks together. We also, years ago, pulled a group together to deal with homelessness. And we have had significant improvement because of that, too. So we felt like if we want to take another step, we look at what Franklin County did, we bring folks together and see what we can do as a more unified body. So we began thinking about how do we create a plan. And we had a basic project scope that would be around community food security in Montgomery County. We have a definition of community food security that drove much of our thinking. And it's a condition in which all community residents obtain a safe, culturally appropriate, nutritionally sound diet through an economically and environmentally sustainable food system that promotes community self-reliance and social justice. A good definition. Okay, it won't fit on a coffee cup, but it's a good definition. And it told a little bit about what we wanted to do. One of the important decisions that we talked about is we don't want to just do what we currently do better. We wanted a food plan that would look at systematic changes and help us look at what we can do to get at the roots of the problems, not just treat the symptoms better. We had made a little bit of progress on this in some ways. So we have a joint strategic plan that's mostly Montgomery County and the United Way of Greater Dayton. And what this did is look at funding priorities. So over the last couple of years, food access had moved up to be a high priority for funding. And that was important. That meant that more of our projects got some funding. And this was a good step. However, it didn't give us a plan to address hunger. It didn't bring new ideas. It helped fund the new ideas if individual groups brought them, but it didn't really bring us that big picture. So it's an important step, and it helped bring some funding, but it didn't give us a community plan that we really need.
We also have our community health improvement plan, just like any other county in Ohio. And under priority 2 for chronic disease prevention, we were working on a few different food access related initiatives, but those were primarily through funding opportunities we already had through the state. And so there really wasn't that community voice in those parts. It was just, what are we already doing because we have funding? So we did have a little bit of support here, but it still just wasn't quite enough for what we were looking for.
So let me walk you through the timeline. We'll take a few minutes on this. And actually, even before we got to step 1, there were a couple of steps. We had a Dayton-Montgomery County Food and Hunger Coalition that had been around for a couple of years. And they had community leaders and had some meetings and addressed some of the hunger issues, but they really felt like they weren't being the most effective group they could be. So we called the groups together, the leaders, to talk about what's the next step? How do we make things go further, do more. And that was what we started with about 2 years ago. And we had just heard Brian and Jaleesa present their plan at the Food Summit, and that's when we identified the need for a community plan. So we had this rough timeline here about creating a plan. And we began researching best practices and looking at what we wanted our plan to be. We had a couple of ideas. One is that we really wanted systematic change. We began pulling people together, and as we did, we saw a few different issues. Some folks were focused on big picture, big ideas, long range. Others, though, were saying, look, we have people who are hungry now. We have people who want help right now. So we need to also do some immediate steps right now. We knew that we had a fairly short timeline. The community leaders, the commission's leaders, they did not want us to take 2 or 3 years on doing a real elaborate plan. So we had a shorter timeline than we may have wanted. So our first couple steps were to bring some people together. We began talking to folks. We had a lot of coffee with people who might be involved in a plan process, and we talked about a scope, an idea, a framework. And at one point, we saw whole measures for community food services. And this was one of the most important underpinnings of our entire plan process. If you aren't familiar with whole measures, I encourage you to take a few minutes and look at it. We really wanted equity and justice to be an important part of it, but we weren't sure how to do that. Whole measures gave us a framework. Whole measures bakes equity into everything that they do. And so by looking at whole measures, we had an idea of how to frame our process. We began doing what you often do. We hired a facilitator to help us with some of the planning process, especially in the beginning. I find it very useful to have an outside person who's not involved in day-to-day food to give you some big picture, to bounce some ideas off of, to kind of run point on process, not making the decisions, but to help us with process. So Montgomery County agreed to pay for a facilitator to help us with some of our basic planning process. We had a couple of retreats where we looked at definitions, brought people together. We had about 15 people. And the process was important. The retreats were important because we got some common definitions. And as mundane as that sounds, it really helped us work through the next steps. As important as any of the concrete things that came out of the retreats was the idea of getting these people in the same room and thinking together, looking at the problem together. We have all been doing it individually, but let's talk about our shared concerns, our needs, our challenges. So the retreats, we did 3 half-day retreats, were an important part of our team building. And the team building is crucial because to make this work, people have to work together. We began to get step 3, some community input with stakeholders and community members. Some of that happened in the retreat, but we also went out and did, again, more small meetings. We did distribute a survey to get some ideas of what people saw as priority and needs. Now, with whole measures, they have 6 different groups, and we'll go into it more later. And we decided in one of our retreats that we were going to structure our plan process around those 6 different groups. We call them branches here. We wanted to use a similar structure to what we already use in the county and public health uses to address drug overdose and infant mortality. And again, we'll go into that more, but we wanted to use a common format. That was one that everybody was comfortable with. It's tested. We knew it would work. So we began identifying individuals to be co-leads for each of the 6 organizations. We have an annual food summit, and we really use that as our stop point. We wanted to have a plan to present this November. So we had our branches meet a few times to talk about what they see as goals and objectives, what's most important to them, how they would work toward completing activities underneath those goals and objectives. We knew because of the November food summit, we wouldn't have a 40-page fleshed out plan. We wanted to get the basics to folks and then let the implementation begin as soon as possible. So we have a briefer plan than Franklin County and some of the other ones. But this November, we finally presented, it was a big moment, our food equity plan at the Food Summit, and we'll walk through that a little bit more.
So to kind of talk about some of the things Mark was mentioning is we have a few frameworks that we used as we developed the coalition and the food equity plan to help guide the process. So the first is collective impact, and this was important to us because it really helped us focus on, one, having a backbone organization, and so really having someone that could full-time focus their efforts on this. And so public health has taken the lead, and my sole job in this position at public health is to manage the food equity coalition and the plan. We also needed to have a common agenda. We all know that we all work for different organizations with different missions and visions, and to really have to come together and discuss what that mission would look like and all work towards the same thing. Shared measurement is really important because, as we all know, food is really tough to measure success. It's not a mortality rate. It's not something that you can count people. It's just more difficult. And so we really had to think about what would those shared measurements look like for this initiative. And also mutually reinforcing activities. As Mark had mentioned, we can't work in silos. We really need to think about how we could work on activities together to get a bigger bang for our buck. And continuous communication, as I'll show in the next slide. This is a great way to just make sure if things want to continue happening, and we need to make sure we have continuous communication. So something a little bit unique for Montgomery County is we really like using the incident command system as a framework for collective impact initiatives. And so if you're not familiar with the incident command system, this is really what your county is using anytime there's an emergency situation. And so it's something that comes from federal government, but it's helpful because it's already set up to help coordination among multiple organizations. It already optimizes collective impact. It helps clearly define roles and responsibilities for everyone that's a part of the coalition, and assures shared decision-making based on the structure. It also supports constant communication and using an incident action plan, and is scalable to meet the needs of the incident or issue. And Mark and I were half joking earlier because we said Montgomery County has unfortunately gotten very well with the incident command system, as we've had tornado, we had some issues with city water in 2019, and we had the shooting in 2019. So unfortunately, there's a lot of us that have gotten even more experience using this system than we would have liked, and we have plenty of pictures that we could use instead of this guy here from us out in the community. But then one of the important things about using the incident command system is the incident action plan. This is a 30-day progress report, essentially, but it really helps hold us accountable in the coalition because we have to have stuff to write in the incident action plan of what we've done in the past 30 days. So it really helps to make sure that we're not just having meetings to meet, but we're actually working towards things and getting some activities completed every 30 days. And then I'll go into a little bit more about who this 30-day plan is shared with every 30 days. And again, Mark had talked a lot about it, but we did use whole measures for community food systems as well.
Again, this whole measures is a value-based, community-oriented tool. You can use it for evaluation, planning. It's very, very fleshed out if you want to use the entire process that they outline. We took the basic ideas and then we localized it, but it looks at things like culturally appropriate and nutritious food accessible to everybody. A lot about local food production, which is important to us. We have some growers here, and we also surrounded by communities with a lot of farms, so we wanted to do that. Fair wages and conditions are crucial. We know that a lot of folks working in the food space do not get good pay, they do not get benefits, they're not good jobs, and what can we do to improve that and encourage folks to work in the food space? Social justice and empowering diverse people to work together are all parts of whole measures that we wanted to have as part of our plan.
So this is what the structure for the Food Equity Coalition looks like. And it is very similar, as I said, to the incident action system that we would use in an emergency. It's the same setup and structure. So you'll notice the six green boxes in the bottom half of the structure. Those are also, you could think about subcommittees, but we do call them branches. And these are the 6 conditions of a food system that comes from whole measures. So we have food insecurity. This is its own group. It is essentially, one of the things I should say we wanted to do with this coalition is make sure that we weren't recreating the wheel. As Mark said, we had a lot of stuff already going on. It was just bringing people together. So the food insecurity branch or subcommittee is essentially the food bank and its member agencies or food pantries. And so this is about providing food for all and creating a just food system. It's really about that essential or that first need of just having enough food to eat. The second is strong communities, and this is co-led by our Job and Family Services and Hall Hunger Initiative, and this is a group that really helps make sure that we're putting our community first, that there's civic participation, that we're not making any decisions without community members that are impacted by community food security at the table. So they ensure that there is a member of the community in every branch and help elevate the voices of our community. Then we have Vibrant Farms, which is co-led by the University of Dayton and our Montgomery County OSU Extension Office. And they're really looking about how do we support local sustainable family farms? How do we make sure that farms in Montgomery County have the resources that they need to grow food? Then we have Healthy People. This is led by Public Health and one of our federally qualified health centers. And this is really about providing healthy food for all. So going above just that basic need of food, but how do we ensure people are getting access to healthy, nutritious food? And then we have Sustainable Ecosystems, and this group is really looking at food waste, soil management, but thinking about how do we grow and sustain a healthy environment. And lastly, we have Thriving Local Economy, and this is really that connection, jobs and our economy to our food system. This group is led by the City of Dayton, as well as someone from our Economic Development Department here at Montgomery County. And so, of course, all of these groups intertwine. Things that they're working on are going to connect to other parts of the food system, which is why there's a green box above those 6 boxes called Operations and Planning section. This is an opportunity for all of the co-leads to meet every 60 days and talk about what they're working on and how to help each other. And they also just work through different problems, different things going on. This is also where I would sit to help put together our incident action plan, or our 30-day progress report. So essentially all 6 branches would work on what we've been doing in the past 30 days, and then I create a report that goes to the yellow box, which is our backbone support section. This is really about guiding vision and strategies and mobilizing resources. So one of the most important things about this group is it's a group of individuals that are in leadership positions and can help make a decision at that same meeting for their organization and can commit resources. We just had a meeting yesterday. This is where you'll see a lot of directors sit, some CEOs, or maybe a food contact at our hospital. So it has hospitals, businesses, nonprofits, government, our food bank. We have quite a few individuals on this group. And they really help make all the big decisions and make sure that all of the branches are well connected. Above that in orange, we have the steering committee. This is where our commissioners sit. You'll have health commissioner, county commissioner, and city commissioners, as well as former Ambassador Tony Hall. And then on the side, you'll see some supporting branches. We don't have a finance unit right now, but this comes into play with funding opportunities that come through to help make sure that we're providing coordination of funding sources. We also have a data unit that can help us make sure we have all the information that we need. This would be kind of like your epidemiologist at a health department. And then Joint Information Center. One of the hardest things I think about all the work that we all do in Ohio is that it can be difficult to coordinate common messaging. And sometimes the media doesn't do a great job of really making sure we understand the issue. They pick up on, well, Dayton was the second hungriest city based on some organization that none of us had heard of before or something. So having a Joint Information Center, it really helps make sure the messages come across consistently and are the right messages. to go out to our community. We've also found this helpful because a lot of times the media will call and ask for a comment on a grocery store closing or something going on. So if we can all have consistent messaging and make sure people know about the really good assets we have in our community and not just talk about the problem all the time, has become helpful.
Okay, now the actual food plan, drum roll please. We decided that the food plan would be brief, partially with timing. Our branches had only met a few times before we needed to stop and get this written to get it out and present it at the summit. But also, that's how we wanted it. We wanted the branches to do the work, and we wanted to have our general idea, and then we send the task, the ideas to the branches, and they develop them. They make the things happen. So we were happy with a very brief plan. One of the first things we did is look at a couple of goals. And this was something that Backbone Committee that Haley just talked about did. We wanted to come up with a couple of things that we could try to measure and key goals. And three very basic ones. Decreasing food waste. We saw that 15% is in our landfill, and we know nationally about 40% of food is wasted any place from the farm to the landfill. We want to increase the availability of healthy, affordable, local food. All three of those things are important, the healthy, affordable, and local. And that's a huge challenge for us. And we spent some time yesterday talking about that, and an overall decreasing food insecurity. We came up with a couple of broad objectives to help us guide our thinking.
Mm-hmm. These are pretty consistent with collective impact that you might see. It's just really about making sure that we're bringing assets and organizations to the table to work together. And then I want to go through a little bit more about what the food plan looks like. And so really the food plan is the blueprint for what the coalition is working on. And so each of the branches came up with their goals. They reviewed survey information from multiple surveys that have went out to the Montgomery County community around food. And they also got a chance to review data, but also have people at the table that are impacted by these certain areas or are experts in these areas of our food system to help determine what this would look like. And at the same time, we wanted the plan to be something that any community member could read too and have a pretty good chance of understanding. So it is very short and succinct and straight to the point with what that key measure is. So for food insecurity, their goals are to review and analyze their childhood hunger programs to identify better ways to serve the whole family. So this includes a childhood hunger strategic plan that the food bank already does every year. And they're really just looking at how can we better serve children for food. So this could be an in-school food pantry or a mobile resource or something similar. They want to also identify and address hunger relief programming gaps and areas of unmet needs. So we know our food bank is constantly looking at where food pantries are and using their mobile food pantry to go to areas where there aren't a lot of food pantries or food donated to the community. And also expand the food bank's partner agency capacity. And by partner, we really mean our food pantries. So making sure we're supporting and providing good technical assistance to the pantries that are working in our community. With strong communities, as I had said, this is really the one, make sure this is we're really making sure we're staying community-led and community-based. And we all want to strive to that, but we all know how difficult that can be when you work a full-time job to make sure the community is a part of all of your decisions. And so the first goal is to expand community food initiatives in Montgomery County food deserts. This is broad for a very specific reason. We did not want to back ourselves into a corner when there's a lot of really good work going on. So this goal really helps make sure that we can assess different things going on in Montgomery County and support those that are showing success. We also wanted to amplify the voice of residents impacted by community food security and ensure inclusion of those with lived experiences in conversations and policy making. So some of the things that they may be thinking about is perhaps there's a food champion toolkit, or are we making sure quarterly that we do community conversations to update people about how the food plan's going and what they think and if they want to become involved or have ideas. Sustainable ecosystems, again, really looking at soil management and food waste. So we want to increase opportunities for people to learn about good soil management. That's through education, but also promoting actual implementation of soil management services. Obviously from these, they're going to work closely with our Vibrant Farms branch to make sure that happens, and supporting development of a closed loop food system through composting. How can we do more composting? Recently, our food bank just became a class 2, I believe, composter at the food bank. So not only are they growing food and distributing food, but now they have a mechanism for composting the food. And the goal is that sooner than later, the food bank can not only compost their own food, but have food come to them from the community too. Healthy People has a broad goal, and again, for a very specific reason. They want to develop healthy food zones in areas with low community food security. So they've identified 3 zip codes that are food deserts, and we're going to be looking at healthy food zones. And every one of these zip codes could look a little different. We're starting with community conversations in those 3 zip codes to really find out what the community members think a healthy food zone would look like, and what would be helpful for them to make it easier to access healthy food. And so there's a lot of different ways this could go, but we really want to make sure it started with what does the community want. We also have Vibrant Farms, and the main thing that Vibrant Farms is looking at is how do we connect farmers to the rest of the supply chain? How do we enhance communication amongst farmers so they can plan for what the demand is in Montgomery County, explore and support a distribution and aggregation mechanism? We really needed to look at how do we get food from the grower to the consumer. And so institutional buy-in will come in here, and how we look at how can we coordinate so that if a hospital or a university has already expressed interest in buying local, what is the mechanism to do so? How do we bring our growers together? And also promote agriculture education programs. We all know that urban farming is really popular right now, and a lot of people want to do it, but we really want to make sure that they're getting the proper education before they even get started to really understand what they need to do so they don't have the issues later on. We also want to keep pursuing additional grants and financial resources. Something that's been loud and clear from our local growers is they need funding, and they need money if we want them to support this local food system. And obviously advocate for public policies and practices that support agricultural use. And lastly, we have thriving local economy, and they're really looking at, we don't have a really good food shed assessment done for Montgomery County. And so one of the first things they're going to be doing is how do we put a dollar amount to our food system? What does our food system really look like? And they also want to look about expanding capacity of the local food supply chain. How can we get more local food out to be purchased? And how do we get more businesses to buy for their institution? And we also want to look at creating more local food system jobs. So we're looking at with our workforce development program at Montgomery County to how do we connect food jobs to some of the programs that they have. And also financing mechanisms. We would love to do a revolving pool of funds for community food projects that we can get a lot of different organizations to donate to. That would be either financing or grants or what that looks like, but we really want to see how can we support more entrepreneurs in this community around our food system. And then lastly, our economic development department is looking at how do we incentivize grocery stores to come into our food deserts? What are the barriers to that, and are there things that we could be doing for certain communities like Trotwood, where the entire city is a food desert? We need a store in that community is one of the biggest needs. So we didn't want to leave that out because that's something that our community talks about a lot, is we want our stores back.
Okay, let me summarize it, and we'll have some time for questions. So what you just heard, that food plan, we presented at the Food Summit. The nice thing is, while we didn't always get as much community input, we had 300 people at that summit. And each of these 6 branches had someone get up and present. Some of them used videos, some of them used some pretty entertaining exercises. And we helped these 300 people see what we have planned. And we also encouraged folks to join, be part of it. And when we got a number of people to sign up and join one of the branches. So I did kind of a summary of what we did so far. So some of our key decisions is that this would be fairly brief, and there would not be the long assessment. Many planning processes begin with a year or two of assessment, and there's a lot of value in that, but we ended up not doing that. Now we're looking at food shed as the next step. With the brief process, and honestly, there were times when I wanted a little more full-blown plan, but I just accepted that this is the first iteration of the plan. It's not published 5 years. We don't make any changes. This is a living, growing document. It's more like Wikipedia than an encyclopedia, something that will be updated every time we meet. And we really wanted to focus on systematic changes. Again, not just doing what we already do a little better, but how do we change it so we don't have to have people going to pantries as much? How do we change it so that people are making a good living working in the food space and local growers are not going out of business, but they're actually increasing? Equity has to be part of every single thing we do. And then once we got around whole measures, that again was our aha moment that really helped us come up with a framework for all of the ideals that we had. One of the important things too is, and she didn't mention it, but Haley is a full-time person in charge of this coalition. I've worked with coalitions where there's no full-time person and it moves slowly. By having someone in this position that's helping the coalition go, we are able to do a lot more. We can focus on things and things move quicker. We make sure that there aren't groups who aren't meeting and nothing happens. She mentioned the incident command system. So our most recent meeting, there was a report that she did, and every one of the groups were, the branches were given updates to the backbone committee, and we had a chance to make sure it kind of holds people feet to the fire and we keep things moving that way. The collective impact framework is very important. It's one that we use throughout the community for other projects. So people were used to it. It's a tested system. And whenever possible, we like to build on whatever already works rather than trying to create something new. Because when you create it new, not only do you have to test it, but you have to sell it. So this way, people were comfortable. Yeah, we've used that with the drug overdose, with infant mortality, with homeless. Yeah, let's use that. It's a good system. We can tailor it to our specific needs. People were comfortable with it. And spending time getting agreed upon definitions was very important too. I think what we could have done better, and this is something that nags me still, I would like to have had more community input into both the development. I'd love to have had some real good community sessions where we talked about lived experience needs, and also more community input in the implementation. So that's one of the things. One of the branches you notice is strong communities, and they are going back, and they do have some good community input there. So we do have it there, but we are now working to get members of the community in each one of these branches. So it's not just the leaders, it's the folks who deal with food insecurity every day. Overall, it was a good process. It took a lot of work, but we pulled a lot of people together. I think doing it the first time is a challenge because you don't have any kind of framework, any kind of idea. And we spend a lot of time trying to think about how we just envision a food plan that works for Montgomery County. With that, I'll open it up to questions.
And here's our logo, in case we're really proud of this logo, but this is really we wanted to show what equity was and make sure we could use this opportunity to educate people about what health equity means through our mission and our logo.
All right, so I am going to make it so everybody has the ability to talk, so giving them permission. If you have an older version of Zoom downloaded, it might not allow you to talk, but I'm going through the list right now, and most of you will have the ability, so feel free to answer questions. I did see that Jennifer put one in the chat box, and so we can start with that as I go through this list. Jennifer asked, how many members make up the coalition collectively? And do members serve in multiple capacities across subcommittees?
That's a great question. Right now we have about 40 organizations that are part of the coalition, and we really just publicly announced the coalition at the end of November. So we have quite a few more people that are joining all the time. So I expect that number to continue to rise over the next quarter. And then also, yes, we have multiple people that serve on multiple branches because they just really enjoy this topic, or it's really relevant to what they do. And I have found that actually very helpful, because all the branches sometimes talk about the same thing and kind of forget what their branch is working on. And so having those people, well, hey, you know, this branch is also talking about this, so maybe we could do this to complement their initiative, has been really good.
And some organizations, such as a couple of our hospitals, might have somebody on both healthy people and strong communities, and also on the backbone. So big organizations can definitely cross-pollinating.
Beth also submitted a question. I'm not sure if Beth can talk, so I'll read it. But it says, who leads the Healthy People and Sustainable Ecosystem branches?
The Healthy People branch is led by someone here from Public Health, our Chronic Disease and Prevention Supervisor, and then also we have a representative from Five Rivers Health Center, which is a local federally qualified health center in Montgomery County that actually does some really cool food initiatives with their patients. And then for Sustainable Ecosystems, it actually has 3 co-leads. We have someone representing University of Dayton that works in the sustainability field. We also have someone from Montgomery County that does our green initiatives for the entire county. And then the third one is Susan Jennings. She is with a sustainability farm, actually in Yellow Springs in Greene County, but does a lot of work here in Greene County. So we have 3 really good people that really understand the sustainability issue and how that relates to food.
That's probably the toughest area for us. That's one of the smaller groups, but we have excellent leaders on it.
All right, let's see. Is there any other questions anyone has? Again, you've been given the ability to speak if you'd like, and then there's also the Q&A in the chat box. All right, well, I will take the silence as a no, so we can go ahead and get wrapped up. Thank you so much for presenting today for the network. We appreciate you guys taking time out of your day. And if anyone has any questions, they can contact you, correct?
Yes.
Yeah.
Okay.
Yeah, feel free to email or contact us. We're happy to talk about it.
You can find the food equity plan on Public Health Dayton Montgomery County's website.
Okay. And then, so again, this is recorded and it will be available within the next week. It'll be sent out through our listserv. And then hopefully we'll have some information for you guys for the February virtual convening, which I'm still in the process of scheduling. So we'll get that out to you as soon as we can. But thanks again, Haley and Mark, and everybody have a good day.
Thank you.
Thank you, Amanda.